Now, as we gather for lunch, we're excited to dive into our next plenary session. We're thrilled to welcome Eric Geyer, who will be sharing practical advice about breaking down silos between criminal justice and behavioral health agencies. Eric is the CEO of Addiction Recovery Center and a Level 3 certified alcohol and drug counselor, and brings with him 25 years experience working with Jackson County, most recently as Director of Jackson County Community Justice. Prior to joining ARC, Eric served as the chair of the Jackson County Local Public Safety Coordinating Council and chair of the Alcohol and Drug Planning Committee for Jackson County. So please grab your lunch, find a seat, and let's get ready for another enriching session. We'll have time for questions at the end, so feel free to text those questions to us. And enjoy the session. Let's continue the great conversation. And come on up here, Eric. And I just have to say that I've had the pleasure of working with Eric over the last 20 years when he was in community corrections. And he is a real thought leader and someone that I've looked up to for a long time. So it's a real pleasure to have you up here, Eric.
Thanks.
Yeah. Yep.
Thank you, Paul. That means a lot. You've been somebody who's absolutely led the state in so many of these difficult conversations. And as I welcome our group up, that's to an extent, that's what this plenary this session is about. It's about what have historically been some difficult discussions, some areas where one people speak the language of public safety, the other people speak the language of behavioral health, and we're trying to find how we go forward within that. So we'll talk a little bit about that. And I thought one of the ways we could do that was by having the panel introduce themselves. And I'll just tag on a little bit to what Paul said, because I did work for Jackson County for 25 years. The first 4 were for Health and Human Services, doing youth and family outreach. 4 years I got to work with juveniles who were in a residential setting. I then worked with adults who were in a transitional correctional facility. And then I got to be the director for the last 6.5 years. Much of what I did was influenced by the amazing team that I got to work with and the brilliance of those that were doing that work. And then also to have Kiki on the panel today, sorry Kiki, start right out by embarrassing you, one of my absolute mentors in how this work can be done and where it can be of use and restorative to individuals. So what I'd like to do though is, as we each introduce ourselves, is talk a little bit about our career journeys, kind of where we've been, how we've gotten to the point that we're at now, and where some of those crossovers between health and the criminal justice system really have spoken to you in your career. And I thought maybe our first presenter could be a person who enjoys jujitsu, is a good friend, and somebody who is an absolute leader in this. So Devarshi, I would kick it over and ask you to introduce yourself. Devarshi Bajpai.
Hello. I wasn't sure if this was working. So my name is Devarshi Bajpai. I'm the CEO of Fora Health. We're a substance use treatment provider in Portland. And I've been in that role for about 1.5 years. So going back, like Eric said, in my career, so I started my career as an alcohol and drug counselor at the agency that I work at now, back in 1994. So I've been doing this for a long time. I was an alcohol and drug counselor. I went to work at the Department of Human Services before they split up into Oregon Health Authority. And I was on Governor Kulongoski's methamphetamine task force with Rob back there, and I'm sure other people in here were part of that too. So part of what we did with methamphetamine was to expand drug courts around the state. So I went to the Criminal Justice Commission, helped manage that grant. The grant program at the Criminal Justice Commission grew, so I got to, when we're talking about the intersection between behavioral health and criminal justice system, that was really my really strong introduction into this area. Went from there to Multnomah County, running the Medicaid health plan for behavioral health in Multnomah County. So I got to see the healthcare side of things, work with primary care providers, with the hospital systems, and then back to Oregon Department of Corrections as a behavioral health director. So I've spent the last 20 years of my career, I've been bouncing back and forth between the healthcare and criminal justice systems.
Perfect, thank you. And the next person is someone who is from Southern Oregon and will claim it and admit to it. And I have been a fan of hers ever since we met at the Oregon Recover Summit, I believe 3 years ago. Amanda Esquivel, Ireland, please introduce yourself. Thank you.
Hello, everyone. My name is Amanda Ireland Esquivel. I'm the executive director of True Colors Recovery, which is a nonprofit organization based in Portland, Oregon, that provides recovery mentoring services, outreach efforts, and recovery housing to individuals that identify within the LGBTQ+ community. My background is a bit different. I am a person in long-term recovery, which for me means that I haven't used a substance or committed a crime in over 8.5 years. Thank you. I kind of fell into the behavioral health realm unexpectedly and unintentionally. Came up to Portland, Oregon to get a bachelor's in graphic design and then got looped into peer work, and I had never experienced that being down in the valley. Peer services were booming up here in Portland, and I fell in love with the work. And so once I realized that we could change people's trajectory by sharing our lived experience, that was something that I wanted to go ahead and commit to. And so we ended up launching a nonprofit organization with our fiscal sponsor, 4D Recovery. And for me, doing work within the Department of Corrections is extremely valuable. I know the importance of seeing that people can succeed and change their life. And I've been motivated by individuals, taking a new pathway while I was incarcerated, seeing people succeed out here. And so, we're really focused on trying to go ahead and bring peers into jails and institutions, provide educational support and educational opportunities for people that are adults in custody currently, and uplifting the voices of individuals and adults in custody that have the skill set and ability to go ahead and be peers themselves.
Great. Yeah. Thanks, Amanda. All right. And as I said earlier, one of my absolute mentors in this work, Kiki Parker Rose, who also has roots in Burns, Oregon. So everybody gets a fun fact. That's yours. So, yeah.
I'm a Highlander.
That's right.
I'm Kiki Parker Rose. I'm the Community Justice Director now in Jackson County. I came in after Eric retired. I started my career as Devarshi a long time ago, and when I started, we were really, and folks in this room may have heard me say this over the years, but we were really the tail 'em, nail 'em, jail 'em kind of community correction system, right? We were parole and probation officers who we told people what to do, and when they didn't do it, we put them in jail, and they got out of jail, and we were trying to figure out why they didn't change their behavior. And lo and behold, evidence-based practices came along. We started looking at criminogenic risk factors. We introduced, in 2003, there was legislation for evidence-based practices. We started really looking at a person as a person instead of what we see on paper. And when that started, that really started a trajectory in community corrections to start looking at people again as people and not paper. And what I mean by that is we have a lot of challenges in community corrections, but we also are beginning to really understand and realize that the people that we're providing our care and supervision to every day also have those same challenges. And being able to open our eyes to that has been a really positive thing for us within our field. I worked in Klamath County for a number of years, about 26, and when I was in Klamath County, we created a really cool opportunity. We were one of the first Southern Oregon counties to embrace peers. Above All Influences was the peer organization that we brought in. And they helped us do things like find ways that when somebody releases from prison, because when they came to us in Klamath County, they were still oftentimes in their prison clothing. We did things like, let's get them out of their clothes as soon as they get here because we want them to begin to identify as being back with us in our world. We connected them with peers right away so that we could have that lived experience voice. And we did a lot of non-traditional work, and I think we'll get into that as we go. But I think that what I would really like to convey on who I am and who I've had the opportunity to work with is not really about me, my, or I, but about we, us, and our. And I think that's the language that we all should be speaking every single day. And I am thrilled to have the opportunity to appear with this panel. I've just met Amanda, right? Yeah. And sorry, you can tell I just met her. And she's a ball. She was a kick. We were having a good time out in the hallway. I think that I, again, just want to convey that we don't have to always do the same thing because we've always done the same thing. And it's okay for us to ask, why are we doing it? And can we do it differently? And can we do it better? And so as I worked in community corrections for 26 years, I retired, did some private work for a while, and now I'm back in community justice in Jackson County. And it is fun, and it's exciting, and I'm really just thrilled to be part of the team. So thank you, Eric.
Thank you, Kiki. All right. And last but not least, we have Scott Hyde. And Scott, your fun fact is that today is a fun sock day at your kids' school.
Correct.
And in solidarity, you are wearing fun socks. And do you want to share about your socks prior to the introduction?
Sure. I did this so you can all see them. These are Macho Man Randy Savage, for those of us who are familiar with that superstar of a human being. I'm representing him in solidarity with my kids at Fun Sock Day at school, so I promised them I'd do it, so here I am in my Macho Man Randy Savage socks.
Thank you. And Scott's work as the Director of Community Corrections at Josephine County is the reason he's really up here, and his also perspectives from law enforcement and as an LCSW. So I'll let you tell the story with a little more detail, Scott, as to how you got here.
Sure. So, my name's Scott Hyde. I am the Director of Josephine County Community Corrections, and as Eric mentioned, my career in this field has kind of come full circle. I started working for Grants Pass PD as a patrol officer back in 2008, and through my interactions with the parole and probation department there, I really enjoyed the work that they did and the people that were a part of that community. So made the move to community corrections in 2012, worked as a PO there for, 4 or 5 years, moved into the supervisory role, eventually became deputy director. When Nate Gowrie came over from Jackson County, and then when he left and went to Washington County, I took the director job. So I've been doing that for just shy of 2 years now. And I think as Kiki said, one of the things that we really strive to do is figure out how we can do it better, right? At the end of the day, if we're not trying to get better, if we're not looking for ways to improve, if we're not looking for ways to connect with people and connect them with services in a meaningful way that improves their lives and improves community safety and does all the things that we're trying to do, at the end of the day, I can't live with myself. And so our organization is constantly looking at how we can get better, and hopefully we get into some of that conversation today.
Great. Thanks, Scott. So I thought we could open up by talking about some of the challenges that are kind of shared between both sides of public safety as well as behavioral health. And those have to do with transitions. And so whether that's a transition in level of care or a transition in custody level, that tends to be a place where people don't always have their needs met, and we tend to go backwards rather than forwards in how we support people. What are some of the ways you've seen that play out and that you've been able to impact those different areas of transition?
I'll go.
Okay, thank you.
I think I touched on it, right? When we start looking at, as folks are coming to us from the institution, how is it that we're treating them when they come to us? And again, it's not the paper, the big files that get to us when they are getting ready to release, but the people and what it is we can connect, how we can connect them in the community. I think some of the biggest challenges really have come from, I'll just say it, lack of funding in some areas. And I also think that we have probably historically not done a great job of saying, wow, we don't have to do this work all by ourselves. We have a whole community of people that can help us do this work. And so finding ways, as I think part of this is called, is breaking down silos, like thinking outside of the box on who can we actually partner with. Can we partner with a church organization or a faith-based community? Can we get impact and feedback from the folks that have already come down this path from peer organizations? Can we find ways to partner with our food banks? And do we have somebody that can be there to help sign somebody up for the Oregon Health Plan? So I think that we've done a lot, especially I would say over the last 10 or 12 years, of trying to find ways to meet the needs of the population that's coming out. If we don't address the social determinants of health, then it's really difficult for us to impact behavior change. And I think that's probably one of the biggest things that we've been able to look at is if somebody doesn't have housing, how can we expect them to do anything but figure out, where am I going to go tonight? Where am I going to sleep? And what is that going to look like for me? So I think maybe for transitioning from the community corrections perspective is just looking at other ways that we can address behavior, and you hear me say care and supervision. It used to be, supervision, service, sanction. It still is, but we have to put a lot of care into the people that are coming back, either from the institution or remain in the community that really need help and really need social services. And so finding ways to figure out what's in your own community and then connecting with them is really important.
I was thinking about this earlier, about how the criminal justice system and the healthcare system both have an interest in using our highest, most expensive resources for the most difficult, most acute people, right? And so we want to make sure those transitions, when people are coming from those higher levels of care, that they're not going to go back there, because we want to preserve that resource, either prison, jail, or hospitalization for the person that really, really needs it. So those transitions are so important. And in the healthcare system, one of the things we know, if somebody's leaving if they're leaving psychiatric hospitalization, if they get a check-in with somebody within 7 days, if there's that care that Kiki mentioned, if somebody is paying attention to their needs, making sure they're getting what they need, they're much less likely to go back to the hospital. And we know that that's the same thing with parole and probation officers. We know that's the same thing with peers. That human connection that we can build with somebody during that transition is really, really powerful, at a really powerful time for them.
Yeah, I think the only reason why I am up here or in the position that I am today is because I had opportunity once I was released from incarceration, right? And so I did time at Coffee Creek Correctional Institution, and during that time, I was able to go ahead and build a relationship with my mother. And so when I got out, I didn't have to worry about where I was going to sleep, how I was going to go ahead and find food, where I was going to be able to get clothes that fit me properly. I was able to go ahead and get released to a stable household, and then also be able to start planning for my future, right? And so those opportunities allowed me to go ahead and really change what I thought my life was going to be. And as someone who provides peer work now, like those are the things that we can go ahead and give our participants, right? And so being able to go ahead and build a relationship prior to release, so that way it's not scary, or not calling somebody or a stranger when you get released, right? You're actually going to go ahead and engage with somebody that you built a relationship with. Being able to go ahead and identify what your needs are. Sometimes that's even hard to go ahead and do as individuals that have been in a survival mentality the last decade of our lives. And so I really think being able to go ahead and provide opportunity for choice is something that we as peers are able to go ahead and establish with individuals. And we've seen that work really well when we are talking to people while they're doing a short time at the county jail, or as well as 6 months to 1 year before releasing from a correctional institution. Being able to go ahead and establish that relationship and really make these success plans upon their release.
Yeah, I think I would probably add to that is that we have had to learn, I think on the community correction side, to understand how big of a deal that is for somebody, and to really be patient in that process. It is a huge thing to come out of custody no matter where it's at, whether it be on the DOC side after having been incarcerated for a period of time, or even at our local jail. What we found is that we have this expectation for them to immediately be released and hit the ground running. That's just not how it works in the real world. That is an overwhelming, all too often unknown process for folks. And so we've kind of started to look at that. We've realized that we need to try to remove as many barriers as we can, try to create as many supports as we can, and engage them every step of the way. And a lot of times that looks at something as simple as us, when they release from our local jail. And we would say, in parole and probation, you have this little clause at the end that says you have 24 hours to report to your probation officer upon release, right? And so we were tracking that for a period of time. We realized none of them were showing up. They would from 1901 Northeast F Street in Grants Pass to 510 Northwest 4th Street in Grants Pass, there's some vortex that happens. They just get sucked into some black hole. And so what we realized is something as simple as us going over there with our car, waiting for them to come out of the doors, putting them in a car, saying, hey, can I get you a little bit of food and bring you back to the office? Having a correctional counselor waiting for them to develop some kind of case plan. When you compare the difference between those two systems, it's unbelievable. And so we decided that's just a fundamental kind of bedrock process for us locally, and we've seen a huge difference in that.
Thank you. When we look at the Affordable Care Act and CCO involvement in planning and helping build systems of care, what has been your experience over the last 15, 20 years in terms of what that process has looked like and how it's changed the way we look at our service allocation, and to what degree are you included as an active participant in helping shape that within your given sphere?
When Medicaid expanded, I want to say it was 2013 when the Medicaid expansion occurred, we didn't really believe that was actually going to start covering some of the services that were available in the community. We reached out to our coordinated care organization, our CCOs, and we started having conversations with them because what we realized, and I think Devarshi talked about this, is our population was the highest users of the emergency room. The emergency room was their primary care doctor. And so by bringing that information to our CCOs, I think that kind of piqued their interest, like, wow, maybe we could do something about this because this is a really expensive primary care doctor that we're dealing with. And so I think being in a position that you can reach out to your CCOs and have some of those conversations, we were able to do that in Klamath County and Jackson County. We have two great CCOs, and we have some of our Jackson County team is here today. I mean, we are looking at the 1115 Medicaid waiver expanding into carceral settings, and we have a team already between our CCOs and our providers and the county having the discussions now because we all have the same population, and coordinating the care for that population is extremely important.
When I was at Multnomah County working with the CCO, it was during the Medicaid expansion. During the Medicaid expansion, we went from having about 150,000 members to about 250 or 300,000 members. I can't remember the numbers, but that was a lot of members. And in that membership, we had to figure out who our highest priority people are. One of the things that we were talking a lot about back then, and we're still talking about, is people with an opioid use disorder. And so when we looked, because I was at the county, I was able to match up the CCO data with our jail data, and we found that a significant number, something like 50 or 60% of people that had an identified opioid use disorder in our healthcare system had been in jail at some point in the last couple of years. So, I mean, for a healthcare system, that's if you can find half of your people with opioid use disorder while they're in jail, get them started on medications, you're going to reduce overdoses, abscesses, endocarditis, a whole bunch of other really expensive conditions. And so that's just one example of how our systems working together, especially if they can share data with each other, could be really powerful.
I would say locally we've been very fortunate with our CCOs as well. And so, and taking kind of a page out of Kiki's playbook and saying you really have to engage with your local CCOs. We applied for a small little micro grant, $10,000, and I honestly can't remember what it was, but that started this conversation that's now kind of this continuum of exchange of information between us and them and identifying what are the gaps in services that we have, and like, here's the money we have available, how can we utilize that money to the best of our ability to serve your population. We've been able to come up with some very creative things, and I'm super grateful for those relationships. And I'm also grateful for that little bit of buffer zone between like not having to see something right here, right now, like needing this. We have this ability to take the money and say, okay, if we're going to build it, what would it look like? And let's try that, and let's realize that's going to take a little period of time. And then as you go through that process and you start to kind of see what the end result of that is, we decide, all right, let's truly invest in this. Let's really try to build this thing. And having the CCOs on board and like understanding that has been just huge for us. It's given us a lot of comfort, and it's made us feel like, you know what, we have a chance to try to get this thing right and not just do what's the next best thing. And so we've been really fortunate in that regard.
Yeah, for the organization that I work for, we have gotten support from CCOs based off of grants, right? And so none of our services are clinical, so we don't have the opportunity to go ahead and bill Medicaid. But what we have been able to do is build a relationship with organizations that have seen the value of what peer work can do, and been able to go ahead and provide support to service areas for that CCO. And so, we're thankful for that. But there's a little bit of concern too, right? Because like grants aren't guaranteed on a yearly basis. And so, that is a barrier for us to go ahead and be able to plan long-term, 5 years, 10 years down the road. Is like, are we going to go ahead and have this funding still? And so, that's something that we as an organization worry about on, a biannual basis. So.
Well, and I think that when you talk about things like organizational memory and building long-term leadership and really being able to invest in peer-based services as a career path, to not have those assurances makes it difficult to really establish that vital level of care. So, yeah, that is a challenge that we face right now. Speaking of peers, how has the introduction of peer-delivered services and particularly shifted the criminal justice system, both in terms of services provided and the people providing the services, because of what that does? Yeah.
Can you repeat that question? I'm sorry. I was
No, fair enough. How has the introduction of peers shifted the criminal justice system and the use of people with lived experience, both as a decision maker, a service delivery person, and to the people who are also, delivering in common?
Yeah, thank you. For me, the way that I go ahead and see like the biggest impacts is when I'm working with adults in custody currently. And so, I've been grateful and had the opportunity to be invited into a lot of the correctional institutions in the state, specifically OSCI, OSP, and CRCI. And being able to go in there as someone with lived experience and talk about, how I went ahead and have been successful in my life now, as well as being able to talk to individuals that are trying to go down the peer path themselves, it's a real big point of inspiration. People are wanting to go ahead and start developing their career path, and they're thinking about this while they're incarcerated, and that's a huge difference. When I was incarcerated, I was just worried about not getting arrested again when I got back out, and so being able to have these experiences and an opportunity to be able to do something different, have a pay that's going to go ahead and help me, continue my life when I get out too, and peers, we get to show up in different environments in a whole number of different ways. So, pre-treatment, post-treatment, during incarceration, and being able just to be consistent with an individual, no matter where they're at in their journey, has made huge impacts with individuals, especially with just staying in services. Not putting a time frame on services, but being able to be in services for as long as I need, whenever I need it, no matter what part of the continuum I'm in.
I've sometimes talked about peers as the kind of connective tissue between systems. We have, our systems often don't talk well to each other, our healthcare system and our criminal justice system, but even within that, treatment providers don't talk to each other very much. Peers often provide that kind of connection between different systems. When, like Kiki talked about, when we see, if you're a parole and probation officer, you're seeing this person in front of you, you're seeing their risk factors, you're seeing their needs and what kind of responsivity factors you have to address. When the healthcare system is looking at somebody, they're seeing their chronic health conditions, whatever acute conditions they might have going on, and how you treat those. But a peer, that interaction that somebody has with a peer, they're actually interacting with a human, all those issues that are going on. And so peers often provide that connection between the criminal justice system, the healthcare system, the child welfare system, between treatment providers, between housing and treatment. I mean, there's so many places where we need connections, and peers often are that place where those connections happen.
I'll just say that I think from just a super baseline level, I think the people that I've interacted with professionally would much rather talk to a peer than me. They want to talk to somebody who's walked a mile in their shoes. They want to talk to somebody who has this capacity for empathy and compassion. Who wouldn't want that, right? And for me to sit here and say, you should do this, you should do that, I don't know them. What gives me the right to say that other than some statute that says, now you guys are assigned to my caseload, I'm going to say you should do all these things, when you have somebody else who's done that, been there, walked a mile in your shoes, comes to you and says, you know what, this is what worked for me. It may or may not work for you, but I can tell you what it was like. And to have that level of connection, I think that it has become again, one of those things that we can really build on the professional side as far as corrections goes, and we can build on those conversations that have happened, and so we rely on them heavily, I can say, in our shop, as far as those interactions with peers and peer supporting them through. It's been a really, really nice place to start from. It feels like a lot of the heavy lifting gets done there, and then we're able to come in and add some things around that. So yeah, I'm super grateful for it.
In Jackson County, we heavily invest in peers. We have peers embedded throughout community justice. So we have them at adult parole and probation. We have them at our transition center. We have them within our juvenile system. We also have created a great program, the sheriff is here from Jackson County, with the jail where we've been able to start having peers come into the jail facility, which is something that's big for us. With part of our CJC funding, we've created this jail release program, and it's all about connection with peers and service in the community. So it's been the piece of our system, I think, that we haven't really been able to capitalize on, maybe the last 7 or 8 years. We saw tremendous success in Klamath County, in the early years, but I think that peers are now in a position, and we're now in a position that it isn't about this is my client and this is how my case plan is. This is our client, and we're going to work together for our people and for our community. And I think it's just shifting. It's not ownership, it's community ownership and providing that opportunity. And then the other thing I think that is important to talk about with peers is, and Eric, under your leadership, Jackson County created what's called the Voices of Lived Experience. And so Eric put together this incredible panel of people that come in that have lived experience, and they provide input in Jackson County on how certain things are done. And we've continued that, and for our jail release program that we have a questionnaire that we fill out, and we took it to them and we said, we need your help. Can you just help us ask these questions the correct way? And they did, and it was great, and they gave us this wonderful feedback. So I think continuing to make sure that we're open to voice, regardless of where you come from, we need voice within the system, because it takes, again, all of us to make sure that our communities are healthy and livable.
And thank you, Kiki, and I'll pass it over. When that process of Voices of Lived Experience really started, first of all, the folks who were coming and participating and making it happen called it the Breakfast Club. They wouldn't call it the Voices of Lived Experience. But Shannon White was actually part of that process, and so we had brought her in just to say, talk to some of these folks, hear their story, and make that. And it was those kind of collaborations and really dynamic conversations, which aren't always easy, but when centered around people with lived experience, the whole nothing about us without us ethos really comes forward, and I think they become a lot more valuable and actually lead to change. So that was really an important piece. Yeah.
I think all of these systems have really recognized the importance of peers in the last 15, 20 years, and so there's been more and more demand for more peers, and often we're having workforce issues. So one of the programs that I like to plug, especially while I'm here, is a program that we started at the Department of Corrections when I was there. I don't know, you guys had the misfortune of having to hear from my friend Nick Crapser this morning, but Nick and I worked together at the Department of Corrections to start a program where we trained AICs as peer mentors in the state penitentiary. Those AICs are delivering services to each other, and then now they're starting to get, some of them are starting to be released. I was able to hire one a couple weeks ago. And, often these peer jobs are one of the rare jobs where having a criminal justice history is a plus, where it might be even a minimum qualification. So it's such a great place where people can get great jobs, great benefits, and really give back to the community, and it kind of works out for everybody.
Yeah, and specifically to that program that you helped start, those individuals, those CADCs, those peers are the ones reaching out to our recovery community organizations too. Like, that's how I was invited into OSCI, was from an individual from the Lifers Club that wanted to go ahead and do an alcohol and drug seminar and wanted to go ahead and invite individuals in as well. And so these relationships are being built by adults in custody with us. And so we're able to go ahead and see where we can go ahead and come into the facilities programmatically and talk about our experiences and provide education and stuff.
And I just want to add, there's another piece to peers, and that is when you're in public safety, sometimes you don't always see when somebody's successful, because if they're successful, they don't ever come back to you, right? And so having peers, and Captain Aldrich is here, that come into the jail and into our transition center gives people an opportunity to say, wow, people are successful. Wow, that can really change behavior. Wow, it is important how I interact with somebody when they're within our transition center or our facility or within our offices. And I think having people come back into to where they were, into that carceral setting or maybe supervision setting, can help change the culture within that setting as well. And I think, Captain Aldrich has recently talked about, he just feels like there's a different kind of culture being made within the jail based on having those peer relationships and seeing the people that were maybe there 3 or 4 years ago coming in and really uplifting the folks that are currently there.
Thank you. So I think as we look for a closing question, this doesn't have to be our closer, but I was thinking about within your communities, where do the dynamic discussions happen? Where do the rich, real things are being talked about, decisions are being made, new perspectives are being shared? Where do those happen? Because in Jackson County, when I worked under community corrections, and I hate to say this, they bought our lunch, so I'll say it. Sometimes they happen because of JRI conversations around prison usage. And they weren't always fun, but they were really important. They brought people to the table in a way that led to some really important changes. And that, to me, I think is so valuable in our communities. So if you have a sense of where those are within your organization and work, where they happen.
I mean, I'm in the Portland metro area. It's super complicated. And so I don't know where the conversation, they happen all over the place. But we often, our systems, whenever they overlap, we often have places where we can talk to each other and work on this. But if people are here from Multnomah, Clackamas, and Washington counties, they might have a better answer than I do.
Yeah, I think my answer is, those conversations kind of develop from engagements with our participants, right? Our engagements identify something that is not working for them, and then our staff bring it to an all-staff meeting, and then we have a discussion around it, like how can we go ahead and eliminate this barrier? How can we go ahead and create, another program that can support this individual? And so it's pretty communal when it comes to that. And then also conversation starts with the adults in custody right now, too. Them, starting listening sessions and inviting individuals and leaders from different communities to come in and listen to what they have to say and the barriers that they have, and us being willing to do that, and then the department allowing us to go ahead and come in to listen to that. And those are where we're seeing, really big changes happening, is because why not hear it from individuals that are being impacted the most?
I think for Jackson County, our local public safety coordinating council is where a lot of the conversations begin. But some folks, the county folks know I say this a lot, the relationships in Jackson County are incredible. I mean, we pick up the phone and call one another if something doesn't feel like it's working correctly. And it doesn't matter if it's a peer organization or if something's working great, like HHS, a peer organization, another county agency, other SUD providers, mental health providers. There's a number of folks that we just pick up the phone and call because we have those relationships built. So when we need them, we can call on folks because we've already created those really positive relationships.
Yeah, I was trying to think. I mean, I think within kind of the more structured, formal settings, we have a lot of those conversations, but I always go back to just kind of those organic one-off conversations where somebody's walking through the hall and has an idea one day, or they hear somebody mention something, or we have a conversation and a random thought says, what if we tried this? And then all of a sudden that turns into a little bit larger conversation that turns into another one, and they start to kind of build, and we get those ideas in front of the right people who can make those decisions and then can support that through funding or whatever it ends up looking like. And so I guess that's kind of a long answer to say I think they come from everywhere. And I think one of the things we try really hard to do is make sure that we don't dismiss any ideas, that we don't dismiss any thoughts, that we give everything equal opportunity and equal thought and bring it to the table and really kind of hash it out and try to be open-minded about that. And I think a lot of times those ideas come from places other than where we anticipate them coming from. And that's one of the things that we have to be very mindful of. And so we've tried to be intentional on that, at least in Josephine County and our organization. I think that's been fruitful for us.
Great. Well, Paul, I think we were given until 10 till, so I don't know you can do much better than where we landed if this works, but I want to thank our panel and thank everybody's time. Appreciate it. Thank you.